Good morning, I'm Deborah Kafoury. I'm your Multnomah County Chair. And I want to start today by acknowledging just how difficult the last 15 months have been because of COVID-19. And then a series of natural disasters, bringing smoke, and then ice, and then deadly heat. All throughout COVID, we lost our routines and our balance. We lost family and friends, and many lost income and stability. We literally saved lives by staying home. So frankly, it feels particularly traumatic that the very week our state reopened, the very moment our community could officially begin the long road to recovery, we faced yet another once-in-a-lifetime crisis. A crisis in which staying away from others and staying home could be and was deadly. The heat that settled over our county, over our family and friends, was life-threatening. And it arrived decades ahead of our best predictions for when this kind of climate disruption should first appear. And yet years of monitoring for heat and cold, of opening cooling and warming shelters and creating safe shelter for COVID-19 had primed county employees to act. We opened 3 24-hour shelters and 9 libraries. We sent out more than 60 outreach teams with tens of thousands of water bottles in hand. And we did more than just rely on the media. We contacted vulnerable neighbors directly to warn them what was coming and to tell them where they could find safety. We called thousands of seniors and people with disabilities, and we texted 12,000 pregnant and nursing moms. We sent out messages in 10 languages, called building managers and development companies. County employees worked through the night, every night. And that's why when the death reports began to come in, we were devastated, and we still are devastated. Because of the dedication of the death investigators at Multnomah County, we now know that at least 54 people in Multnomah County succumbed to this heat disaster. Many of them were our elders, those who need our care the most, and many were all alone. I want to extend my deepest sympathies to the families and friends of everyone who died. And I want them to know that we are resolved. In this report, and in the even deeper reviews that you will see in the coming months, we will find the lessons of this heat event. We're talking with the City of Portland, the State of Oregon, 211, TriMet, and the City of Gresham, and figuring out how they can come alongside us in this preparation and work. And we'll be sharing all of that with you as well. Because the climate disruption we all feared would happen someday is happening right now. And we all need to work together as a county, as a resilient community, as neighbors to prepare. And we need to work together as humans to save our planet right now. And with that, I'm going to ask Dr. Jennifer Vines to discuss the preliminary review.
Good morning, everyone. Thank you for being here. I'm Dr. Jennifer Vines. I'm the Multnomah County Health Officer. I will just share that over the last year, we have prepared for a surge in deaths because of COVID-19. And a year ago, we were just emerging from restrictions, and honestly, it never crossed my mind then that we would see a wave of deaths from heat as we have these last few weeks. So while hundreds have succumbed to COVID, we're now looking at least 54 out of a suspected 71 in Multnomah County who are confirmed to have died of heat-related causes. I also want to join the chair in sending my condolences to the friends and loved ones of these individuals. And I want to extend a special thank you to those families who had the courage to share their stories for this report, to put a human face on these deaths, and to share more of what happened. I also want to say that none of this information would be available to us without the 24/7 work of the Multnomah County Medical Legal Death Investigators. They respond when called, day or night, to a death scene. They do the detailed and painstaking work of documenting the circumstances that allow our state medical examiner to determine the cause and manner of death. They've logged almost 200 hours of overtime in the last 2 weeks, and they literally talk to families and loved ones on the worst day of their lives, and they do it with grace and compassion, and they return phone calls, they enter data, again, all while staying on call to report to death scenes. So I want to personally acknowledge their work and thank them. You now have the report. Keep in mind this is preliminary. This is the result of many hours of work to do an initial analysis, but I expect much more detailed analyses in the coming weeks and months as we all try to understand what happened and what we can do to protect our communities. Again, of 71 suspected Multnomah County deaths, 54 were confirmed heat-related as of July 9th. The age range is from 48 to 97 with an average age of 70, so that affirms what we know, which is that older individuals are at higher risk of heat-related illness. All but 4 identified as white, and the majority died in their homes. About half in a multifamily unit, which is like an apartment building, another almost third in single-family homes, and then some in a mobile RV or car. The majority of them died alone and without air conditioning. And of those 8 who had an air conditioning unit, 7 had them unplugged or they weren't working. The deaths happened all over Multnomah County. Nearly every zip code had at least 1 death with the range of 1 to 6. And the majority of the deaths were reported on or after Tuesday, June 29th, which ironically was the day the temperatures came back to seasonal normal. So again, I'm happy to answer more questions. You have the report, but I'm going to hand the microphone over to Chris Voss, our Director of Emergency Management.
Good morning. You know, the chair identified a lot of things that the county did to help mitigate this incident. And now we're here reading this report that identifies a lot of people that unfortunately succumbed to the extreme heat. It's my office's responsibility now to take this report as well as other tools that we plan on implementing to see what we can do to minimize the impact of a future event. Often after-action reports take many months, but my office anticipates trying to put together an initial findings report within 30 days. That report will focus on some of the quick things that we can do, understanding there's still a lot of summer left. Some of those areas might focus on transportation, outreach, communication, staff recruitment. It's things that we can do now in case there is another incident later this summer. And we've already started this process. Later this year, we also anticipate releasing a final report that will address not just the short-term issues, but also the long-term issues that we know we want to sort of take a close look at, that we can't do quickly. But my office, unfortunately, will read this report, look at it to see what we could do next to help us minimize this impact in the future.
Questions for any of our speakers, and also we have Kim DeLeo here as well.
Questions for Chris?
Yes.
The report obviously doesn't outline anything that's going to be done at this point. You're alluding to the fact that there are some things in the works right now. Can you detail some of those things that are in the works right now? For example, is the county stockpiling fans at this point? In other words, for when the heat occurs in the next few weeks, in the next month or so. What are some actual things that are actually being done right now?
Sure. You know, just this week I've had a conversation with the city of Portland, specifically around the area of cooling centers. You know, one of the things that the county did was we opened up several locations, but we definitely believe that there's an opportunity for improvement there where we can open more locations that'll be closer to the people that might need that support. So that may be one of the areas that we're going to look at. Obviously, we've got to address the things like staffing and supplies as well to support those locations, but that might be something that we look at initially. We're also looking at how how transportation worked. We utilize a call center, and some of the reports were such that it took quite a while to sort of get through to that call center and to receive things like transportation resources. So that's something we want to look at quickly, knowing that there's things that we might be able to do in the short term to help improve our response in case we needed to do something just even later this summer.
So about increasing the door-to-door.
In your comment just now, are you referring to 211 and it not being as accessible over the weekend as it should have been?
211 is one of those communication systems that we plan on having a close look at to see if it's meeting the needs of the county and the people in the community.
So what specifically do you plan to do?
You know, and this is why we walk through the after-action process, because it's not as simple to say, okay, this didn't work. We're trying to find a mechanism that we believe that will work better And so obviously that's something we need to take a close look at. We've utilized them for many, many years, but we also want to make sure that they can support us during the worst of times. And so that's one of the things we'll take a close look at.
We contacted people that we have contact with already. We have many, many programs that come through our Department of County Human Services, through the Health Department, Healthy Birth Initiative. So we have a database compiled of vulnerable residents in Multnomah County that we are able to get in contact with. For example, years ago when that big fire happened in the Cully neighborhood, we were able to contact people who live in that area who are on our caseload to inform them of what was happening with air quality.
Will tell you how many individuals you actually did contact? I mean, you said thousands, but specifically.
Yeah, and Julie Sullivan Springhetti can get you that information.
One more question. Do you, of the people who died, do you know if they were contacted, or how many of them were contacted, or how many were not contacted, anything like that?
I don't at this point.
What are your thoughts on air conditioning? The people who died didn't have it or didn't have it working, yet there's a number of public buildings that Home Forward has in this county that don't have air conditioning for those vulnerable people. Should that change?
I think that's a conversation that we need to have as a community. We know that we already have a housing crisis, and we have many of our neighbors who are living on the streets unsheltered. We traditionally have not had air conditioning in buildings. I grew up in Portland, and I never had an air conditioner in my house. So I know that this is a process that we need to go through. If these heat waves are something that are going to be more permanent and more frequent, then having air conditioning and other ways of cooling people in the summer months is going to be incredibly important.
So you think that there should be more then? Because, yes, the times definitely have changed. And a lot of these buildings were built when you didn't need air conditioning. So we're not trying to point fingers there, but it's like,
Right.
what about next?
I think as we move forward, when we're creating new buildings, we need to look at making sure that they have proper cooling facilities. I don't know that not an expert here, don't know if air conditioning or a heat pump, what the correct and proper method is, or high energy efficient fans. I think those are all things that we are going to be looking at in our after action report.
But retrofitting the existing ones?
Hard for me to say again whether the cost of doing that, is it better just to have a window unit or a fan, or does that just create more issues? As we learned, many of the people who passed away did have air conditioning and just weren't using it. So I think these are all questions that we will be analyzing and talking with people in the community too about what if they were unable. I mean, a lot of people don't have air conditioning, and talking with them about what would be best for them in another disaster like this.
I wonder whether anyone's reached out to anyone in states which deal with hurricanes, which are similar in the way that you can see them coming and you can prepare for them and move people in that event. I wonder whether anybody reached out to something like that.
I spent most of my life on the East Coast, so I've experienced a few hurricanes and sort of deployed for a few. There are some similarities, and so. But we also, even when we're looking at sort of heat waves, we research things like Chicago heat waves to see what they've learned over the last 100 years, because they've had several where there's been, unfortunately, very, very significant loss of life. So in this case here, we're not just taking a look at this incident here in Portland, but we're in Multnomah County, but we're taking a look at the many, many instances and how we can sort of prove, and the lessons learned from other cities as well that may have had to actually had a significant event.
You mentioned libraries, 9 of them being opened. Any reason why more weren't available over the course of that weekend?
We have been preparing our libraries for reopening, and part of that has been upgrading some of the HVAC systems in them, because not only we had the heat event, but we've had a smoke event recently too, so we know that we need to make our buildings at higher quality than they've been in the past. So not every building was ready for reopening, and we you know, this is one of the things on our after action report that's going to detail is where mapping our community to see where our cooling centers were, and whether, for example, having community centers that the city runs, having the additional libraries open would make a difference.
So is that to say that air conditioning wasn't available in those facilities, and that's why they weren't open?
No, but some of them are under construction. We use this time period to where places were shut down to upgrade our facilities. Many of them were in preparation for putting higher standards because of COVID-19. Now, of course, some of that isn't necessary, but the buildings are all in different stages of preparation. They will be open throughout this rest of the summer. We will have all of our libraries open.
This is looking more on a statewide level. Yesterday, the Office of Emergency Management said that a lot of the responsibility falls on cities and counties in order to ensure safety. Do you agree with that statement, and did the county accomplish that?
I'm going to be meeting with the governor tomorrow, where we are going to be talking through these issues. I think what we did learn from this event is that it can't just be one jurisdiction. It cannot. We need to work together as cities, as counties, as a state, and as neighbors. And I'll have Chris Voss talk to that, but I will say we are preparing for a smoke event, a wildfire event, and that's one of the reasons why our after action report is going to come in phases. We're going to have a very quick turnaround on things that we know we need to do immediately, because we know that there's going to be something else this summer. But Chris, you want to talk about wildfire?
Yeah, we obviously we prepare for a lot of disasters, and if there's nothing that we've learned in the last few years, it's that fire risk is significantly increasing. And we've opened shelter support, I think, probably the most unique event last year, and everybody remembers that smoke, was Multnomah County opened the doors and received folks not just from Multnomah County that needed support, but actually Clackamas County as well. You know, the chair talked a lot about how this is it's not just one jurisdiction that needs to focus on a solution, it's everybody. And last year, when we received calls for assistance from a neighbor jurisdiction, we did everything we did to support them, including opening a call center to support them so they weren't as bombarded with them, but also opening shelters, and something that we're going to continue to do. And if, unfortunately, we're in a situation where we're not in a situation where we can do everything we possibly can, we'll continue to utilize those resources as well, and our neighbors, to make sure that we can care for the people of Multnomah County. You know, we received hundreds of people from Clackamas County. I don't want anybody from Multnomah County to go to another jurisdiction, but if the hazard is here and it's safer somewhere else, certainly that we would use that tool in the toolbox. You know, to get into sort of some of the specifics, I think one of the things we do a lot for smoke is we look at locations that actually have MERV filters that can actually filter out a lot of the smoke, and not all those facilities have that. So we actually do look specifically at buildings to see where we could house folks. So the same location that we would use for a shelter for cooling might be different than what we'd use for smoke, might be different than what we'd use for another type of event like an earthquake. So all of those factors, we look at a long list of shelters, and we try to pick what we believe is the most appropriate locations for that event. You know, exactly how many have had that filter, I do not know, but I know that there are several county facilities. I know there are city facilities. The convention center as well is one of those locations that has, you know, an excellent filtration system. It's why we utilized that last year during the smoke event.
The 2016 standard operating procedure for severe weather, I know it talked a fair amount about how to respond to these heat events. Do you think that was an adequate blueprint for this type of event, or do you think it needs to be more robust?
So the county actually, within the county's emergency operation plan, we follow sort of a form and function that it's non-hazard specific. And so we focus, and our plan mirrors the state plan and mirrors the federal plan. And so we very much look at functional areas. So in this case here, there was the conversation about sheltering. We look at sheltering as, it's not always critically important to know why that shelter as much as the community needs sheltering. And so therefore, we've broken up all of those areas that you might utilize during a lot of different types of emergencies, and they're included in that emergency operation plan. So that for us is the blueprint, the same way it's the blueprint for cities, counties, and the state across the entire country. The other nice tool about us all using that same form and function, which is very much recommended by the federal government, is that when we do need support, and we do need outside resources, those resources can come in and can immediately be useful because they understand the form and the function and how we organize. And this allows me to go almost anywhere in the country and be useful the same way that if we needed support from other jurisdictions, they could come here and be useful in the same way.
Did we bring in outside resources?
For this event, we definitely reached out to a lot of our local jurisdictions. So I know while the vast majority of people in our cooling centers and the shelters were county folks, we used volunteers, net volunteers. I want to thank very much those net volunteers for supporting us. The Medical Reserve Corps, other groups that we sort of reach out to. The City of Portland, the City of Gresham also helps sort of staff some of those locations. We want to see all those groups as well as see what we could do in the county to maybe even recruit more folks. But this wasn't just a Multnomah County effort. Certainly we had support from other jurisdictions as well. I want to thank all those jurisdictions as well as the community volunteers that help support us.
Dr. Vines, I have a quick question about some people on your graph died 5, 6, 7, 8 days after the peak of the heat. How can you say that that's related to the heat? It was 8 days later. How do you know?
I can take a stab at that, and then I'll ask Kim DeLeo to help answer that question. So the pattern actually matches what we've seen in the 1995 Chicago heat wave, where after about 48 hours is when the body's own cooling systems start to really come under stress. So that pattern is very similar in terms of the timing of death. Kim, can you talk about when you get called, when you find people, and how you establish date of death?
When we receive calls that people were found, we go out to the scene, conduct death investigations, and based on the scene findings and the history, speaking with families, speaking with neighbors, we determine that likely their death resulted from hypothermia. From there, we obtained samples on scene for testing. The state medical examiner then reviewed our scene investigations and findings and conducted the testing and signed the death certificates appropriately as hypothermia.
So just to clarify on this graph, those people didn't die 8 days later, which is the death was confirmed to be 8 days later?
So the date of death for a lot of these cases is the found time. It's when we arrive and they're listed as the found time on the death certificate.
Without getting too gory, you'd say you take samples. Is there something you can take a sample of from a body and say, okay, this level is high and that's a heat death?
We did obtain vitreous samples from the eye for testing. Some of that testing is not reliable after several days if someone is deceased for several days. And in those cases, the state medical examiner would have signed the death certificate out based on our scene findings and interviews.
Can we just be clear, are these people who were hospitalized and, July 4th, July 3rd, hospitalized and died on that day, or people who were found in their homes?
So
I just want to, I think we should get a clear explanation of sort of the long tail of death.
So, a couple comments. The number of deaths, I believe, includes 2 people who were hospitalized. Yes. Okay. It's also the notion that social isolation is itself a risk for heat-related death. And so when the medical examiners go, they are doing their best to determine the date of death, but sometimes it's actually, people are eventually found by neighbors, by family, realizing that they're not answering their phone, so that there can be a lag there between death and when our medical examiners go on scene.
So these dates that these people were found, were you,
Can you say?
you think that they died during the 3-day heat
Most likely, you know, and there has been some hot weather since that weekend, and you know, a lot of the houses haven't cooled off, so it's possible. It's really hard to determine and pinpoint the exact date. You know, if someone has not been seen for 2 weeks, it's really hard to say, you know, exactly which day, and so we use the found time.
A lot of you have touched on this generally, but you know, this is an extreme event in this area. How much of this review also needs to not be familiar with the effects of heat and how serious these temperatures can be, and not really taking it seriously until it was? I mean, I guess also what I'm getting at is if the wildfires, you know, law enforcement can tell people you must leave and you have to go. At what point do we get to that level where people are understanding how serious this is going to be and have to enforce it?
I will say, and I can't speak for exactly how people heard our messages or if they heard our messages, but we were really clear heading into this event. The environmental health colleagues in the health department flagged this as an important life-threatening event because of the forecasted temperatures that, you know, became more and more certain heading into that weekend, because of the lack of overnight cooling, so essentially no break overnight when the temperatures were still in the 80s. The fact that it was so early in our summer, so our bodies will actually adapt to heat. So a major heat wave later in the summer is actually not as dangerous as one so early in the summer. So we took this very seriously. We purposely used the term life-threatening heat in our communications. We urged people to be looking out for each other, knowing that we were not going to be everywhere in the county for 3 days. So I think we've learned a really hard lesson, and I'm sorry that we're going to be using this event in the future to help convey the risk that heat poses.
Great. Maybe we can take one or two more questions and then we'll...
Tell us the 2 deaths in the assisted living facility, same assisted living facility, what facility, and has that been referred to DHS for investigation?
That is one facility. We're not sharing the name at this moment, and we are using various channels to report to DHS at the state.
When do you expect the county will have the report?
Well, we know that the complete report takes a while. I mean, traditionally it can take a year. That's not an acceptable timeline, so that's why we're going to have a preliminary report out within 30 days that will talk about the short term, the things that we can do, because again, whether it's a smoke event or a heat event, the chances that we have something else this summer are strong. So we want something real quick. The longer term with the other questions that we're going to be answering will be in several months from now.
Okay, everybody, I think that's it. Thank you so much for coming, and thank